Good evening, everybody. My name is Chris, and we'd like to welcome you to the Forget Your Pizza Party podcast. As always, I am joined by
Misty.
tonight. It's going to be a little different. We're going to have more of a conversational tone tonight. Over,
So, we're talking about events going on in the healthcare system currently. We've had strikes go on throughout the United States. We've had a massive snowstorm come through with a lot of issues within the healthcare system. So, we're going to kind of just have a conversation about what's going on, why we're leading to striking, and just have a conversation about how it can be fixed.
right before we get into the full episode, please, everybody out there listening, if you listen to this podcast, please hit that like, subscribe, and notification bell. Tell your colleagues, tell your family members that might be in healthcare that we're doing this. This podcast is by healthcare workers for healthcare workers. We try to support other healthcare workers. We're looking for the same for us. So please hit that like, subscribe, and notification bell.
Sounds good.
All right. So what's the first one you want to get to? Because there's been a lot of stuff in the news lately.
Yeah, I think before striking, before we talk about the strikes, I think let's talk about, the snowstorm that went through and some things that we've read, some things we've experienced in past storms, and kind of what is leading to that strike.
That's fair. And so we worked up in Cleveland for over a decade. Anybody that lives up in Northeast Ohio is aware of what happens during the wintertime. But for those of you throughout the country that may listen to this podcast, Cleveland sits right on Lake Erie,
Mhm.
and the lake effect snow coming down from Canada. In Cleveland, it wasn't uncommon to get 3, 4, or even 5 feet of snow with drifting. Buffalo, New York was even worse than Cleveland, but Cleveland, I mean, there was one snowstorm where we got like 5.5, 6 feet of snow.
Yeah, a good fair amount.
And the weird thing was up there, which I hadn't seen down here, is they get rid of the snow pretty quick. Like the roads are cleared off pretty fast.
Well,
Most
they have the equipment.
they do. I've never been in an area where they park a big huge quarry front end loader, like bucket loader in a Walmart or a Kohl's parking lot, but then you see them all around, and then that's what they use to move snow to the point where the mountains of snow are still present even in July. But they get their parking lots and their roads cleaned off fast.
Yeah, they were very good about that. They do work around the clock. They always have their crews out way to the end to try to do it. They just get out and they get it going
Yeah,
because they know people gonna get around.
yeah, they stay ahead of it.
And people up in Cleveland just know what the weather's gonna be like and they know what they're gonna be facing.
Yeah, and it didn't mean that there weren't stupid drivers or there weren't things that happened, but man, they had it down to a science, unlike other areas. And then we moved down to Columbus, and 9 day difference.
They don't, well, one, they don't have the equipment. They just don't have the workforce to support it.
Right. So why do we mention it? Well, because in Ohio we have snow levels. Level 1, you can still drive, it's not advisable. Level 2, only go out if it's absolutely necessary. Level 3, unless you're an emergency personnel, first responder, healthcare, utility worker, or any other primary essential worker, you stay at home. You don't go anywhere. They will ticket you.
You can get arrested.
You can get arrested in certain areas. So this past snowstorm, Franklin County, where we live, was a level 3.
Hold on. Let's talk about up north first.
Okay.
So, what was your experience as a healthcare worker and the expectations for during these storms?
You know, the weird thing about the systems that we worked at was I feel like they were actually pretty reasonable. I don't think, from what I remember, if you make a reasonable effort to get in, the roads are bad, you're not going to get penalized. You're not going to get written up. Just get there safely. They'll work with you because they have these situations, and they would rather have you get there and be safe than try to rush to make a clock and get injured, hurt somebody else. And again, because they have a lot of these snowstorms, they have policies in place that don't render punitive marks or write-ups to you because you're late. And that's my experience. And then when I was an MP, my boss was pretty reasonable because he would rather have me be safe than get injured, because I was worth more to him being productive than in a hospital. So
I would agree. I never received any emails saying you must show to work. It is expected. If you don't come, you're going to be punished. I never received any email like that. We never got that type of behavior from our managers. Everybody worked together. So, oddly enough, that was one time that a lot of they all came together and everybody understood. We have a lot of nurses that were traveling very far, and like Chris said, they wanted you to be there because you were more productive to them being there than being in their beds.
Yeah.
So, if you showed up late, you weren't penalized. I never called off for snow or storm. Working inpatient, it's not like it closes. The hospital will close. The hospital never closes. And they will always find somewhere for you to go when you come in. So it is a huge effort to try to make it there. We are essential, and there are patients that are relying on us. One thing I have been seeing, though, is in the new some of the articles I've been reading and then just comments on this storm that came through, is that people keep saying, well, we're nurses, we took an oath, you knew what you were getting into. Yes, I agree with that. We did take an oath. We knew what we were going to be getting into, but we're also human.
Well, and I'm sorry, and I'm going to say this, I'm going to take a little different perspective than my wife. My life is more important to my wife and my kids than some facility where I'm taking care of somebody else's family. Because if I'm not around, they're not getting taken care of, and vice versa with my wife. If she's not around, my family's not getting taken care of. We did take an oath. I did take an oath. If I'm in that facility, I will give it my all. But don't expect me to be obligated to come in and risk my safety and my ability to take care of my family for a job. And it is a job. It is a calling, but it is a job.
It is legitimately true when you hear a nurse say, gone today. If you're gone today, fired, they've already got your position ready to go to
Yeah,
hire.
that's amazing. But I thought there was always staffing issues.
Yeah, right.
Yeah. I wonder if it's just planned staffing issues. Like they say that there's a staff or a nursing shortage, and then they run the units lean so they can keep their budgets in check.
Well, after COVID and after all those nurses took a check and said, see ya, the seasoned ones, and retired, that kind of became our new norm, was to run short. And I agree with you. I wonder if this is planned because now it's a way for them to save money for where they
Well,
lost so much
I mean,
money.
think about it. All of the nursing schools and everything, and we got off a little bit of a subject, but we'll come back to it. But all these for-profit nursing schools. I mean, we went to one. All the state schools, all the community schools, pumping out nurses, hundreds and hundreds and hundreds of nurses a quarter, and we have a nursing shortage. It just doesn't add up. It doesn't add up. You don't have that many nurses retiring to offset the demand.
I think a lot of what is happening, though, is you're getting a 1 year nurse in, 2 years, and then they're gone.
And then they burn out.
They either try to go back to school to be a nurse practitioner, a PA. Although I don't think a lot of them are going back and being nurse practitioners.
No, because the field is swamped with too many.
Well, it's swamped, but they're also seeing that it's no different type of stress.
Actually, you've heard me say it. I would rather go back and work as a bedside nurse at a hospital, and I absolutely was so overjoyed to leave the hospital system. But the amount of pressure, the amount of work that I have to do far exceeds anything that I get paid. And, you work your 312s or your 5/8s, and you get to leave it at the door as a bedside nurse. I don't get that option. The only time I get to leave what I do is when I sleep. And
I think that's kind of part of why
right,
there's a little bit of a shortage.
right.
But so let's go back to this
So
this
why, yeah.
recent storm. So some of the things that I'm seeing is that there are, and some of our colleagues and friends out there are kind of in a little bit of a situation because they couldn't get to where they were going. So what do you deem essential, Chris?
So, so in my mind, the hospitals, of course, those patients in the hospitals have no choice. They're there for a reason, medical emergency or whatever. They have to have staff. And I think that's perfectly reasonable. What I deem non-essential for healthcare systems is anybody in the secondary facilities. By secondary facilities, I mean doctors' offices, outpatient labs, outpatient imaging, anything ancillary or secondary to the hospitals themselves.
Nothing acute.
Nothing acute. Freestanding EDs should be open. Outside
Yes.
of that, community EDs fine because that's a funnel source for the hospitals if they need more acute care.
I even feel like some of your advanced urgent cares could be deemed
Yeah, maybe,
essential.
maybe, but outside of that, there's no appointment at a primary care that's essential. There is no appointment at a routine cardiology appointment that is essential. There is no appointment at any specialist that's essential that can't be worked in the next 2 weeks because a lot of these systems for these specialists and for primary, they block out days
And if
to fill
you're,
in appointments.
yeah, and if you're needing to see your specialist that bad, then you're probably needing to go to the
Right.
hospital to begin
So
with.
so that's what I would deem essential. And I work as a visiting home nurse practitioner for primary care. Even I, for myself and the medical assistant, to go around to these people's homes.
But what we're finding is, as we talk to our other friends and other systems and things, there are healthcare organizations that they made efforts, especially in the hospitals, to make sure the work crew, not just nursing, but anybody that was on shift during that time could stay there. They had local places they could stay.
If
That
they were
way,
open.
yeah, if they were open, they had connections with some of the hotels. Yeah, there was a price, and that's up to you if you want to pay that. But they did. They made efforts in the hospital.
I know one of them even tried to offset some of the costs. They wouldn't cover the full cost of a hotel, but they would cover maybe half of it.
Yeah.
Or they bumped the pay
Mhm.
in case the person had to actually find a hotel to
They
stay
were
at.
feeding
They
them.
were feeding them. They were making accommodations because it's like, hey, you made it in here to take care of these patients. You're a rock star. Let's show some appreciation. Let's do something for the people that came in,
And
like they
then,
should.
and yeah, exactly. And then some of these organizations that were agreeing to have their staff stay and they were help taking care of them, they also realized that the crew that works outpatient in some of these non-essential roles, they allowed them to stay home with their families, or if the option was to work from home, they were able to work from home.
Right. Like
So,
they should.
yeah, so once everything was drivable, people could get out, then they were able to go back to their normal routines, and they weren't punished. They weren't under the same guidelines of missing work that you would normally be under.
Like late call offs, late clock ins,
Yes.
all the
Yes.
other stuff,
So
which is
then,
reasonable.
yeah. So then you had other organizations that remained open, and they provided for the staff that were in the hospital and their surrounding area, but they did not take care of the rest of them. So anybody that was working outpatient didn't get the opportunity to have a place to go to get to work and stay through the storm because they remained completely open. Non-essential specialist appointments, all those things
Which is
were
just
open.
absolutely stupid. So listen, I'm one of those people that believes that don't be that individual that if you're asking somebody to do something that you're not willing to do it yourself. So if you're going to if
Exactly.
you're going to make a decision to have everything open, your ass better be in there your freaking car driving there with everybody else
Yep.
instead of sitting in your nice cozy house making these decisions. And that goes for all C-suite level and upper level managers. If you all think that you deserve to stay at home and then call everybody else in and that you weren't willing to go in yourselves, you need to be fired.
You are the problem.
And that is why a lot of these nurses are striking around the country. You all are the ones that are the problem. You are the ones that are in the way of it. You are the ones that are causing the issues.
And not even, and it gets worse. Some of these nurses are actually being penalized. They're getting it. So in the healthcare system, a lot of us work on an occurrence call off system. So you get so many occurrences within a certain amount of time. Once you meet or once you hit a certain level of occurrences, then you start going into like corrective actions and there's like a process and then boom, you can be fired. So these nurses and other healthcare workers that were actually stuck and couldn't get out are being penalized.
Yeah, on Monday, I mean, you have an SUV, and I was like, "Hey, I'm gonna go take the trash because we needed to take the trash." And so I was like, "All right, I'm gonna just go out and see what it's like." I almost got stuck in our own lane. And there was nobody that came around with the plow. We don't have the truck or the plow to even do it ourselves.
And then we even got more snow on top
And
of
then we
that.
got more snow on top of that. I even went out to our one of our main connector roads to get actually to a main road, and it was just as bad. And I guarantee you, if I would have gone down there with some of the snow drifts, I would have got your SUV stuck. And then what? You get penalized because the roads are not cleared enough for you to drive, and then you get into currents. I mean, how stupid is that?
Yeah. You get in a car accident, you end up in the ditch.
Or you
They
lose your
don't
or you
care.
lose your life because they demanded that a non-essential healthcare employee be in there.
So not only are you putting your life at risk, you're also putting your family's life at risk because you're one, leaving your family, and two, you're going to need them to come get you.
Right. Schools are shut down. What happens if your little kids and your schedule dictates that you get them on the bus? In a situation like this, yeah, we all have backups. We're not unreasonable. Most of us are rational. We have backup people in case school gets called off, a kid gets sick. But in an event like what happened Monday, they can't get there. So what are you supposed to do? Well, I guess you got to leave them there and go to work because if not,
You don't have a job.
yes, I think those kind of policies are rules for thee and not for me. Most of those people are salary. They leave work early every day. They barely work on
Family.
Fridays. They don't put if you put a time period on them like an hourly employee, they maybe only work half the time of an hourly employee.
And we're not talking about like your average nurse manager. They're not the ones that make that
No,
decision. They just report to the higher
no,
ups.
I'm
I
talking
mean,
about
we're talking
mid-level,
about, yeah.
mid-level and mid-level, upper level and C-suite. Your CEO, chief nursing officer, chief medical officer,
Then you also got HR involved in it too.
all of them.
Yeah. Yep.
Yep.
So then you get these nurses that, like in New York, they're striking because they need better staffing. They want more pay,
Better healthcare coverage.
better healthcare coverage. They want fair work environment, a fair, safe place that they can go to and work. Because let's face it, as a nurse, you spend more time with your colleagues than you do your family sometimes.
Yeah, agreed.
So,
I know that's happened with us.
and so when you're being punished for catastrophic or extreme events, look at the South where they get hurricanes and things. I would make every effort to make sure I was where I needed to be. Not one of us, you and I know if we were in a situation and there was a hurricane coming in, we would make sure our kids were taken care of, but we would be there to
Yeah,
support.
but we're in
We
a
would make it,
we're in
we
a
would make
different
an effort.
situation. What I know we would do is I know in my heart you wouldn't like it, but I would get you and the kids out and then I would go and work at the hospital because you would need to go be with them and then I would go in.
Well, so some of these people that are being penalized, they're at home, they feel guilty because they're being made to feel guilty for staying home in unsafe conditions. And that's not right. And that's why you're seeing this uprise in your healthcare systems because it's just coming to a boiling point where nobody wants to deal with it anymore.
Yep.
So
You can tell we're kind of fired up about it because I'm actually pretty pissed.
yeah, it's not right and it's very frustrating and it really makes you doubt why we got into this for the patients. And yes, patients should be number one. They should be taken care of and they should not be left alone. And we should not be leaving our staff that is currently working to deal with those that can't get in. I agree with all of that. If you can make the effort to get in and be safe getting to work, then do it because that's the oath that we took. But if you can't physically do it because of something out of your control, and yeah, we had time to prepare for it, but you can't really prepare for something that you don't know how catastrophic it's going to be.
Oh my God. Just can you imagine us going out shoveling 50 yards worth of snow to get to the road?
Yeah, that's just not going to
at
happen.
2.5 feet, 3 feet with drifting and make it big enough for the SUV to get through.
Not to
I
mention,
mean,
they tell you techniques of shoveling and cleaning so that you don't, one, have a heart attack or a stroke
or get frostbite or anything
or
else.
fall and get hurt.
Yep. It's just ignorant. Like the secondary facilities had no business being open.
No, I agree.
But again, like hospitals, absolutely. There's no ifs, ands, or buts about the hospitals. You gotta, if you can get in, you gotta get in there. It was just so ignorant. What other things are we experiencing in the healthcare industry right now?
A lot of it is that staffing issue.
I still think, and there's a couple of people that I follow on Facebook, like Nurse Alex and some other ones that have commented on this. And I've kind of done the math. Up in Cleveland, there were 9 nursing schools that were private, and there were 3 universities that pumped out nurses. I think I figured each one of the private schools was pumping out 60 to 70 nurses a quarter. So 1,000 a quarter, give or take. Okay. You can't tell me that there were that many nurses. So between 3 and 4,000 nurses just in Cleveland alone. And yet they always had a nursing shortage.
Yeah, very interesting.
Yeah. And down here in Columbus, oh my God, how many nursing schools are down here in Columbus?
So many.
Seven, 8, 9
Yeah.
private, online private.
Well, and a lot of stuff, like you said, you can do it online.
You can do it online. I mean, at least probably a dozen, pumping out 30 to 40 nurses a quarter. So over 1,000 nurses a quarter, 4,000, 5,000 nurses a year. And yet Columbus has nursing shortage. Is this planned? I still think it's planned.
I would agree. I think there is a certain point in
Oh,
that is.
it gives the managers an out. Oh, you know what? There's a nursing shortage. We can't find nurses. And we can't find nurses, so we can't staff. But they'll bring in a contract nurse at $5,000 a week.
Oh yeah, there's all kinds of contracts out there for
Yeah.
travel.
Did you remember me? Remember me talking about there was a hospital system in Oklahoma that paid $34 million last year for contract nurses to come in?
Wow.
How many staff nurses could they hire?
Or increase the pay
Or
for
like
the ones, like take care of the ones that you have.
like a retention bonus?
Yeah,
Like a couple of years you're
take
there. Hey, here,
care of them.
not only will you get a cost of living increase, but here's $4,000.
Yeah, they would just take care of their own, then they wouldn't have a shortage.
Like a revolving. I don't think there's a shortage. I would say they wouldn't
a
have
revolving door.
They wouldn't have a revolving door because
That's fair.
like the one system we were up in Cleveland, when we got hired on and went through the onboarding process, there were hundreds of nurses in that auditorium. And every 2 to 3 months, that auditorium was full. They had no problem finding people to staff those positions. What it ended up being was it was a revolving door because they were a lot of these nurses and healthcare staff were unhappy because of the way they were treated.
Well, here we are today.
And they had a conveyor belt of new grad nurses that didn't know any better. They would get seasoned and move on because they tried to find something better.
Yep.
And that's how it is in some of these bigger cities. Now, in the rural areas, I don't think they have the option, but I guarantee you there's more nurses available in the rural communities than what they're letting on to as well.
Yeah. So if you're upper management and you're listening to this, which you probably aren't because you didn't want to hear what we had to say. But anyways, if you did take the time to listen to this podcast, take a listen to what we're saying and listen to the people who are working basically for you. Listen to them.
Yeah. And
take care of them.
yeah, we're the ones that are the front line. Just remember this. We're the ones that work the front line. We're the ones that are taking care of the patients. We're the ones that are making sure that your scores are elevated up to a point where your hospitals and your outpatient centers and your doctor's offices get good scores for CMS.
And inflated salaries.
You think your jobs are hard. I'm telling you what, they're not. I've seen so many managers that earn a salary and I wonder what they do for it because they don't do anything that I do and they don't do anything that my wife does. But you know what? They get to sit at home when a level 3 snow emergency hits and then tell everybody else to come in while they're sitting there with their families sipping hot coffee or chocolate, making these decisions when they're not willing to come in and do the work themselves.
Exactly.
Anyway, that brings up one of my favorite things to say at the end of our podcast. You are more than your job. This is evident after the last snowstorm. You are replaceable at work, but you are not replaceable at home. You make sure that you take care of yourself and your family and your mental health. It means more to you and it'll be the greatest gift you ever give yourself because these healthcare systems do not care about you.
No. All they care is that they have a breathing body capable to do the
You know,
job.
and before we leave, I wonder if they actually had a positive revenue day for all the people that they brought in. I don't think, in my mind, I doubt they even cleared 1/4 of the amount of money they needed to make sure that those facilities and everything was profitable for that day. I guarantee you that they lost a shit ton of money.
Oh, I know, because a lot of it was a ghost town. How can you expect people to drive in and patients are gonna be driving into appointments? Because if they do, they're arrested because it's not considered an emergency situation to go see your
No, but
specialist.
when some of these healthcare systems sent out an email, it said that patients are still able to drive for emergent appointments.
They're
And
not emergent
I'm
appointments,
telling
no.
you what, they weren't emergent, but
They still made their staff come and do the
you all have a blessed week. Get home safely to your families.
stay warm.
Yep. And we want to thank you all for those that managed to get to work, that worked in those hospitals. We've been there, we've done that. You are healthcare heroes, all of you, all the support staff, EVS, food, everybody, laboratory,
And everybody that was made to go to their job.
that were forced.
Yes.
Compulsory work.
Yes. We
Almost like
hear
an
you, we
internment camp.
see you, we know your value.
Yep. And you all are rock stars, all of you, not just the nurses, all of them. Pharmacy, pharm techs. I mean, all of you.
Respiratory,
CNAs, PCNAs,
sonographers,
unit secretaries, all of you. You all are rock stars. You braved the weather to get into those hospitals.
and other buildings.
Yep. Anyway, till next time.
Till the next time.
Bye now.
Healthcare heroes on the grind, underappreciated. Weekend comes, but the pizza's not celebrated. Managers order, they just can't seem to get it right. We gather round, but we're ready for a bite tonight. No toppings, no love, cold slices on our plate. Pizza party, let the podcast begin. Healthcare warriors, let the laughter spin. Through terrible toppings and grease that we dread, we'll keep this conversation alive instead. Chit chat, laughter, it's our weekly unwind. But this cardboard crust feels like a sinister sign. Heartfelt stories wrapped in cheesy regret. As workers unite over this pizza we fret. A slice of happiness, more like a slice of pain. Pizza party, let the podcast begin. Healthcare warriors, let the laughter spin. Through terrible toppings and grease that we dread, we'll keep this conversation alive instead. So here's to the workers, may your pizza improve. Together we'll rise and we'll make our groove.